Hi, I'm Dr. Islam with Lubbock Gastroenterology. Today I'll explain what an EGD with Bravo test or pH test is. A Bravo is a pH test to allow us to see objectively how much acid is going into the esophagus. For a lot of my patients that have chronic acid reflux, or they have a lot of burning or regurgitation, we want to find out the root cause, which typically is what's called the lower esophageal sphincter, to find out if that's the reason why you're having the issues. For a lot of our patients, the lower esophageal sphincter is the root cause of what is going on. The best analogy I have is like having a door that's open wide open. Whenever that door is always open, acid will come up into the esophagus to cause burning, regurgitation, chest pain, sore throat, and other symptoms that are from too much acid. This pH test is going to allow us to see if that door is wide open or not, because if it is, we can give you options to get that taken care of for you. We also do a Bravo or pH test to determine, is it truly acid that is the cause for the problems? Because a lot of patients who don't respond to traditional therapies for that, it may not be an acid problem, it may be a non-acid problem, and that treatment's very, very different. And then lastly, we also do this test in the setting of getting a hiatal hernia fix. A surgeon needs to make sure that the reason that you need that fixed is because the door is not working appropriately. You need to be NPO after midnight, the night before your test. And we may ask you to stop certain medications beforehand, especially if you're on a blood thinner. The next day, we'll do what's called an upper endoscopy or an EGD. This is about a 20-minute test in which we put you to sleep, and we use a small camera to take a look inside the upper esophagus, the lower esophagus, the sphincter, the stomach, and the small intestine. And with this test, I can see how the esophagus looks. And while we're doing this test, I will place this Bravo or pH test in the lower esophageal sphincter to check to see if that door is working appropriately or not. The Bravo capsule is about the size of a large gel vitamin, and we insert this capsule during the upper endoscopy. It is attached to the esophageal lining using a small delivery system that briefly suctions the tissue and secures the capsule in place. The capsule will then wirelessly transmit the data from that capsule to a belt recorder that you carry with yourself for 24 hours. 24 hours later, you'll give us a recorder so we can download that information. Then eventually in the next couple of weeks, that capsule will be deployed. It'll go through your small intestine to your colon and eventually come out in your bowel movements. Most patients feel a little bit of discomfort in the chest area because the capsule that's there. You may have a little bit of chest pain as well. That is normal and that will go away. Other patients may feel something when they swallow. Once again, that is the capsule that's there. Now, because we give you sedation, you have to have a driver take you and pick you up from the procedure. Now, normally in those 24 hours, I want you to do everything that you normally do. I want you to eat normally. I want you to drink normally, so that way I can get the most accurate information of what's going on. So this testing, once again, will allow us to determine, is the valve working correctly or not, and does that valve need to be fixed somehow? In addition, this will also tell us, is the problem truly acid or non-acid? And then lastly, it gets down to the root cause of what is going on. Our philosophy at Lubbock Gastro is not just to throw pills at you, but to understand what is going on with your body, what is the root cause, so we can tailor treatments to get you feeling better. Keep the receiver near you as instructed, record the symptoms in a diary that we give you, and return the recorder on schedule. You can usually resume your normal diet and activities after the testing has been done. Now, if you develop severe pain, fever, or significant bleeding, contact us right away so we can determine exactly what we can do. If acid reflux is interfering with your life, if you're frustrated by your treatment options, and if you really want to understand the root cause of what is going on, talk to us about whether doing an esophageal Bravo test or a pH test is the right test for you. To schedule your appointment, visit us at lubbockgastro.com or call us at 806-696-4440. Well, thank you guys for watching.